My name is Christian Perez, and this is my research project on myotonic dystrophy. There are many different names for this genetic disorder. The most commonly used one is dystrophia myotonica, abbreviated as DM. Dr. Hans Steinert discovered this disorder in 1909 at Leipzig University Medical Hospital in Germany. Sometimes this disorder is named after him as Steinert's disease. Myotonic dystrophy is the most common kind of muscular dystrophy. 1 in 8,000 people get it, often in their 20s or 30s. However, there is a congenital form seen at birth. There are two types of myotonic dystrophy, DM1 and DM2. DM2 is milder. The major problem is muscle weakness and wasting. This disorder is inherited in an autosomal dominant pattern. An abnormal gene from one parent can cause disease. The abnormal gene dominates. As myotonic dystrophy travels through a family, the symptoms occur earlier in life and more severely. The genetic cause of DM1 is when 3 DNA building blocks, cytosine, thymine, and guanine, are repeated too many times in the DMPK gene of chromosome 19. In healthy people, the repeat is between 5 and 34. In those with DM1, it is 100 to 1,000, and congenital DM1, it is 2,000 plus. The genetic cause of DM2 is when 4 DNA building blocks, cytosine, thymine, guanine, are repeated too many times in the CMBP gene of chromosome 3. In healthy people, the repeat is less than 26. In those with DM2, it is 75 to 11,000 plus. Healthy DMPK directs protein production in muscle, heart, and brain cells. CMBP directs production in heart and skeletal muscle. The mutated gene produces an altered messenger RNA that interferes with protein production, and this prevents muscle, heart, and brain cells from functioning properly. Myotonic dystrophy affects the muscular system, skeletal muscles in the limbs and trunk, smooth muscles in the digestive system, and cardiac muscles in the heart. Myotonic dystrophy also affects non-muscular function, such as the brain, eyesight, sleep, and reproduction. Symptoms of this disorder are weak muscles and inability to relax muscles after contraction, such as when shaking hands or turning a doorknob, irregular heartbeat, respiratory problems, cataracts, slurred speech, deterioration of brain function, daytime sleepiness, and inability to have children. Diagnosis of myotonic dystrophy. Doctors will study family history, physical exams, medical tests, electromyography to detect myotonica, which is a lack of muscle tone, muscle spasm, or rigidity, and finally, genetic blood testing, where DNA is analyzed for the DM mutation. Prognosis. Symptoms worsen gradually over several decades and vary from case to case. A mild case, muscle stiffness and cataract, lifespan 60 plus years. Classic, muscle wasting and stiffness, cataract and heart problems, and physical disability, lifespan 48 to 55 years. Congenital DM1, severe weakness and stiffness, intellectual disability, heart and breathing problems, lifespan 45 years. Parents and siblings should be tested for myotonic dystrophy. Usually one parent will have the disorder, siblings may not. Treatment is only for symptoms. There is no treatment to prevent or reverse disorder progression. Drugs are used for muscle stiffness and anti-inflammatories for pain. Rehabilitation such as physiotherapy, speech therapy, and psychiatric therapy. Assistive devices such as braces and wheelchairs, heart pacemakers, and breathing apparatuses are used. Gene therapy is in experimental stages. It is a method of delivering the corrected gene to the cell nucleus. People with myotonic dystrophy can use service dogs for pulling their wheelchairs, performing tasks around the house, and speaking for them when they can't. Speak! 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 Thank you for listening to my research project on myotonic dystrophy. The end.